Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Maureen O'Brien-Thornton and Sabrina Mosseau from the Leukemia and Lymphoma Society. Welcome to the show, ladies.
Thank you. Good morning, Peggy.
Maureen, why don't we start with you? Can you
Okay.
talk about a little bit about what you do for the Leukemia and Lymphoma Society?
Sure. I'm the executive director. I've been with the organization for 11 years, and I pretty much oversee a staff of 10 in a local chapter office right here in Colonie. However, our chapter is the upstate New York and Vermont chapter, so we cover quite a bit of area from Poughkeepsie to Plattsburgh and then all of the state of Vermont. So we're a little bit geographically challenged because we do have a small amount of staff and a lot of people that live in rural areas. The primary market for our chapter is the Capital Region, and then our secondary markets are Poughkeepsie and Burlington, Vermont.
Okay. And Sabrina, what do you do for the Leukemia and Lymphoma Society?
Actually, I've been a volunteer for them for about 15 years now. I've done a number of the fundraising events, patient advocacy, patient services, and currently I happen to be the president of the Board of Trustees for the Upstate New York, Vermont chapter. And my history, my real job is that I'm an oncology nurse, and I work for Northeast Health for Albany Memorial Hospital and Samaritan Hospital. So it's a great partnership to be able to work with them.
Oh, yeah. That's a perfect match.
Perfect match.
Okay. Maureen, can you talk about what the organization is all about?
Yes, our mission is to find a cure for blood cancers, which include leukemia, lymphoma, Hodgkin's disease, and myeloma, and also to improve the quality of life for patients and their families after diagnosis and through treatment and hopefully survivorship.
Okay. And does your organization have a mission?
Yes, and that is the mission, basically to find a cure. So we do an awful lot in the research area so that we do find cures for blood cancers and increase survival rates and also increase treatments, different types of treatments that we can provide to patients when they're going through that phase.
Okay. And your society is a national organization?
We're a national organization. We have 68 chapters across the country and in Canada now. So we're one of 68 chapters, and our home office is based in White Plains, New York.
Oh. Okay. And how many families do you serve, do you think?
Well, in our chapter area, we serve over 500 families. And like I said, we're one of the more rural and smaller chapters. We have chapters in major markets like New York City and LA, Washington, D.C., which serve many, many more families. But what we're really trying to do is reach out to rural communities, the African American communities, so that we reach out to more patients and families that need our services.
Well, it's certainly a challenge to present any care in a rural environment.
Absolutely.
How do you get doctors to go there? They need money because they want to pay off loans and everything else.
Yeah.
That's a challenge in itself.
That's a challenge for not just our blood cancer community, but the healthcare community overall, to get doctors in rural communities where they can afford to give patients good care. But one of the things that we do as a society is offer things to reach out to rural communities, like webinars and teleconferences, so that they don't have to travel to get information about their diseases. We also have telephone support groups, so if they want to participate in a support group but can't actually travel to one, they can get on the phone and speak to people that have the same diagnosis as they do, get some comfort in knowing they're not the only ones out there by themselves, that they have other people going through it and they can share their experiences. They can do it virtually too through our website.
And I think nowadays the internet is also amazing,
It's
isn't
huge.
it? It
Yes.
has nothing to do with who lives close to you. It's
Right.
who is experiencing the same things that you are
Right.
across
It's
the
a
world.
really international community now because of the internet. And Facebook is a huge one too. So I think all of our chapters are really looking into the social marketing aspect as well as,
they should.
we've had a website for quite a long time, but we keep, that updating that and refreshing that as well.
Now, let's talk numbers. What are the incidence and prevalence rates of the blood cancers?
Well, in the U.S., there's over 912,000 Americans living with some type of blood cancer, and they're either in remission or in treatment right now. There are different numbers of people that are diagnosed each year for different types of blood cancer. So leukemia, I think it's about 245,000 people a year that are diagnosed. Lymphoma is about 600,000. And then myeloma is about 21,000 per year. Someone is diagnosed every 4 minutes with a type of blood cancer. Someone dies every 10 minutes with a blood cancer. Last year, they estimated about 53,000 people passed from a blood cancer or complications from a blood cancer or the treatment of a blood cancer. So there's a lot of work to do. The survival rates have tripled in the last 60 years. One of the great things is that childhood leukemia, which is the most prevalent type of cancer in children and young adults under 20, the survival rate in the 60s was 4%. Today it's 86%. So great strides in that area. The percentage of survival rates in adult blood cancers has not been as successful, but we are going upward, and we still have a lot of work to do. That's why we're here.
Now, that takes research, doesn't it?
Absolutely.
Sabrina, can you talk about how the Leukemia and Lymphoma Society helps researchers?
Absolutely. I would think that the most telling tale of their ability to support is since 1949, they've actually granted over $600 million to researchers. And right now, presently, you look at 1949 and you reminisce on the statistics that Maureen actually just quoted.
Right.
And especially in cancer, we have to pat ourselves on the back and say we've come in a tremendously long way in a short period of time. At the same time, we're not doing so great with some of our blood cancers and our blood dyscrasias. And so we start to look and we say, well, do we have success stories? So a great success story in research is a drug called Gleevec.
Okay.
And for a specific subtype of cancer, CMLs, a chronic myelogenous leukemic patients, their survival rate was not very good. If they could survive for about 3 years, you were looking at some good outcomes in 3 years. When Gleevec came along, and the research and the granting of it, primarily funded by the Leukemia Lymphoma Society, Dr. Brian Drucker, in 2001, based upon its approval, all of a sudden we drastically tipped survival rates over on their heads and had people living very, very, very long with CML. Not treating it anymore as you are going to die from this disease. It switches it to you are going to live as long as possible with this disease. And when you have a breakthrough like that, when you look at something and you look at the cell in a different way, it actually generates additional research to say, okay, well, we have this type of drug. What other drugs can start to mimic the same mechanism of action? And how do we do research to go for cure, and if not cure, control, so people live for a very, very long time?
Now, just getting a drug on the market is a challenge, isn't it?
Absolutely.
And it takes a whole lot of money.
It does.
To do that.
It does.
How is your organization helping kind of expedite that process?
A couple different things. So if you look at it from the national level and you go back to the research monies themselves, you say, well, you need to have the money to be able to fund that in-lab research. Everything starts out in a dish, for lack of better terminology, and needs to eventually move to people. So the first thing is, how do you get the brightest and the best researchers, and how do you keep them engaged, and how do you keep their developments active in the market? So nationally, the research dollars going to that is amazing. And when you look now and you say, they got about 60 great research projects in their pipeline, it's pretty much akin to a small pharmaceutical company, a small to medium size, saying there's a great amount of things coming up behind us. And that's the first hurdle, is to kind of get something where it's developed and it's becoming appropriate for utilization in people. The other piece that they did on a national level and affects us locally is a therapy acceleration program, because there's a lot of red tape, there's a lot of miscommunication among multiple individuals. So they kind of three-pronged their therapy acceleration program. They looked at it from the academic piece. Are we getting the youngest and the best and the brightest and the most experienced folks? they look at it from the biotechnology piece, because it's biology. That's what cancer is. Something's wrong in the cell, so how do you go after that biology of that aberrant cell? And the third part is that whole clinical trials accession piece, because that's the piece that gets the client, the person living with cancer, into a therapy to say, this is what we need, because clinical trials lead to the drug itself being approved. So that's the most important hallmark, is to have people accession into clinical trials and to be active participants in the trial.
Do you feel that the oncologists around the area or in general are aware of clinical trials and really try to get patients go in that direction, or does it need a little bit more of a push?
That's a great question. And you look at two different things. So you look at nationally, and nationally the I guess the barriers to clinical trials. Some of that is as simple as money. Individuals from a rural population not being able to travel 6 hours on a daily basis to receive a type of therapy. So that's the first barrier. The second barrier sometimes is just fear. And the fear is people don't want to assume that they're being treated as guinea pigs, that you're going to treat you, but you're not going to treat me. The interesting thing about cancer clinical trials is that pretty much all of the time they're based on the standard therapy, and we add something to the standard therapy. So you're not having something taken away from you. Nationally, too, there is some feedback that perhaps physicians aren't comfortable with sending people on to clinical trials. I do have to say, speaking from my local experience, we work with we have a tremendous amount of resources in the Capital District, and a tremendous number of individuals that have clinical trials going on locally themselves, or they have partnerships or affiliations with NCI-designated cancer centers, and they can accrue clients to clinical trials. So it's a great area to be a part of.
Great. That's good to hear. Good. Now, there's been a lot of talk in the news about healthcare reform and about healthcare in general. Basically, it's all about the patient, and it's all about the patient getting the resources that they need, and the patient being able to afford whatever care they get. And I know some of the cancer meds can be pretty expensive, can't they?
They are.
I mean, if it takes millions of dollars for a pharmaceutical company to create a drug, they've got to get that money back somehow, don't they? What does the society do for patients in the area?
Cancer bankrupts people, for lack of a better term, it really does. And unfortunately, even with healthcare reform, cancer is still going to bankrupt people, and it's going to bankrupt people because of the ancillary things. I can't go into work today. I feel terrible. There's other things. I have to supplement my nutritional status. And this costs X amount of dollars.
Right.
So the piece that will never, ever go away, regardless of healthcare reform, is the ability to aid individuals. So aiding individuals, there's two really great stellar programs that Leukemia Lymphoma does. The first one is a copay assistance program. So regardless of insurance, going in on a daily basis, and $30 out of your pocket every day, say it's 5 days, that's $150 times a month is $600. That's not anything that I think any of us is really prepared for. So they do have a copay assistance program. It's a national run program, application signed off by your healthcare provider. It's based upon 400% of the poverty level, which is very, very nice, because it's not for the poor. It's actually for the middle class down to poor, which is, I think that's stellar to have an organization be that open about that acquisition to that. And the other thing is a local program where the patient will receive $150, and it really is $150 to be utilized as how you need to utilize it, whether that's gas, whether that's a hotel overnight stay, whether it's to help pay for drugs or medications or something else. And the beauty about that is it gives people levity to just have that and have that as a little safety cushion, instead of sitting there and trying to turn in receipts and prove that you're actually living with cancer. That has never made sense to me. So it's great that it's this is for you. What we do, fundraising and taking care of people, is touching people that we live with.
That's true. Now, I got to tell you, being the consumer health librarian at the Colonie Library, it's something I see on a constant basis is people in need of education. They're always trying to research things. They're always trying to find information on whether it's a drug or whether it's a procedure, or a little bit more of a background about something that the doctor told them. And I'm sorry, most of the time I feel like, we don't feel like we can spend enough time with a doctor because we feel like we're wasting their time. And then they go to the library and they try to find things out. But how does the society help with educating patients?
There's a nice, again, it's almost like a three-pronged approach. So the first thing becomes, and people learn very differently, and I love the fact that society says, everybody learns differently, so let's try to get to all those different learning styles. One of them is print materials. Some people are very, very good about having print materials that they have at their house, they can carry with them, and they have the ability to refer to them at any given moment. They're also written in a very, very easy to understand, about the 8th grade reading level, which is where a majority of Americans actually happen to sit. And I have to tell you, being faced with a diagnosis that scares you, you're at an 8th grade reading level, regardless of your, your master's degree or anything else that you may have. The other piece is the ability for those web savvy people. They want to look, they want to listen, they want to see, and their ability to log onto the internet and to go to LLS type webinars and conferences. And then the third way is a telephone support, to be able to actually call, to have somebody answer your telephone call and to have them guide you through, do you need print? Do you need telephone support? Do you need web support? We can get you in touch with the local office where you actually live. So it's a great opportunity to get people engaged, dependent upon how they want to receive the information.
And I'm definitely an advocate for one, going to a trusted website rather than going to a search engine and typing a search in, because I don't know what percentage, maybe 45% to 50% of the information that's on the internet about healthcare topics is inaccurate.
Absolutely.
So that's why, you find a site like lls.org and you get the information on that site because it's trusted information, which is always good. How do you set up a newly diagnosed patient with someone? Do you have some kind of mentoring program?
What is done is we definitely rely on the oncologist's office to do the initial referral, and the initial referral has to be done for HIPAA and a number of reasons, or the client self-refers themselves. When they do that, and again, people have different needs. Some people want to be in the group of support. Some people want to sit with similar, like-minded individuals with similar diagnosis in a group setting. So locally, there is a number, into Vermont, there is a number of support groups in a group setting run by a qualified individual. Other people say, I'm a little more private than that. I really want a one-on-one. And not only a one-on-one, I prefer somebody who has a very similar disease and diagnosis to mine. Wouldn't it be great if they were also the single mom of 2 kids, being diagnosed? So the first connection support, which is trained volunteers who have been living with a blood cancer themselves, that is invaluable to some of our people, because it's not face-to-face, it's telephone. You control that piece of it, and again, it allows choice, and we're supposed to give people choice, so LLS is giving choices for options.
But not everybody gets into the program as a mentor for the first connection. It's only certain people are chosen, right?
Well, they actually, it's not a choosing type of thing for first connection. We actually ask for volunteers living with cancers to step forward and then allow them the training, because being a mentor, and you probably know this, is not the best for everyone, but we have found some stellar human beings willing to step forward and share their experience with somebody else newly diagnosed, and I think that is irreplaceable.
Absolutely. So how does the society educate medical professionals across the United States?
There are a number of different programs. So a couple of the programs say, hey, where is the need? So on a national level, how are we doing with accessioning to clinical trials? We're not doing a great job in the adult population. Children, around 90% of all children diagnosed with cancer will be accessioned to a clinical trial. Adults, we're still hovering between that 4% and 6%. So a big push to the society is saying, how do we get out there and educate everyone, healthcare professionals and lay people, about accessibility to clinical trials, about availability, about how do you know if there's something out there for you. That's one of the first things. The second thing is that the patient services managers and the local chapters have a great, finger on the pulse of the community. And when they're hearing people having feedback saying, well, there's so much changing right now in CML, and I feel like I just can't keep up. then they actually work with local organizations, such as they've done it with Northeast Health, to put on locally sponsored events that are disease specific or
Okay.
treatment specific. So it's good.
Good. All right, Maureen, what about advocacy? How does the society help change laws and contact legislators, things like that?
We actually have a group of grassroots advocates who are volunteers of the society. They are staff. There are people like Sabrina that come down to the Capitol in Albany and talk to the legislators there about the need for one of the big things that we were looking at. Actually, it was, again, clinical trials and creating a fund for clinical trial access and education so that any organization that is disease-related could actually write a grant and ask for funding so that they could have more funding to educate the community about the importance of clinical trials, about the fear factors that you talked about, and the reasons why they're so important. Because if you don't have a clinical trial, nothing gets to the bedside from the laboratory. It just doesn't happen. So you can't get the treatments out there that you're really trying to get into the community without them. So that's one of the things that we do locally. On the national level, we also have groups of volunteers that go to Washington, D.C. every year. We have a mission day. We're on the Hill. We're talking to our federal representatives about funding for the National Institutes of Health and the National Cancer Institute, and now the Department of Defense as well, who might lose their funding. So we're constantly trying to get more funding for research because the research dollars that go into NIH or NCI are actually going into blood cancer research as well. So we don't want to lose that funding because you lose the funding, you lose the best and the brightest who are coming out of these colleges, and they have to make a decision what they're going to do. And if they don't have the research money there to fund a grant for them to work on blood cancers, they're not going to do it. So it's our fear that we're going to lose the best and the brightest if we don't keep the funding level up there where it needs to be to bring the new treatments through clinical trials and to the patients.
Now, what percentage of the advocacy efforts are federal? And I mean, how much does the actual New York State help with that?
Well, it's interesting. At one point, we've kind of changed. The society's priorities have changed in the area of advocacy because it used to be all national. And we would that's what we would do. People from New York State and all the states, all the chapters would bring volunteers to Washington, D.C. Over the last few years, they've decided that we need to concentrate on the states as well. So we're not giving up the national advocacy efforts. We added the state efforts as well. So it's kind of a two-pronged thing. We're doing both. And we have, I think over the last 3 years, we've had a mission day in Albany at the Capitol here in New York State. So we have 5 chapters in New York State. So we're bringing volunteers from all over the state to come to Albany and talk to our representatives. So I don't know what the percentage is really of how we divide that out, but we're really working it as a two-prong effort throughout the year. And all the states that are involved are doing the clinical trial access in one way or the other, trying to get insurance to cover standard care if someone's in clinical trial was how we began it here. It kind of morphed into creating this fund for us, which we did get passed through the Assembly, by the way, and we're waiting for the Senate to move on it, but right now they're pretty overwhelmed with the budget, so hopefully once that gets through, we'll be able to get back in there and talk to them again and get about the importance of the bill. So it's kind of an ongoing thing, and with politics, if you know politics at all, it really is kind of a morphing atmosphere. You might go in there with one thing and come out with another that makes more sense at the end of the day.
As long as you get something, right?
As long as we're getting something for our patients. That's what we're trying to do. We're trying to improve care and access to care for our patients and their families.
Okay, now, speaking of money, obviously the Leukemia and Lymphoma Society does fundraising. Now,
Absolutely.
What sort of events do you do?
We have 5 what we call priority campaigns, which means all the chapters do them. We have our team in training, which is a campaign where we recruit people to run and walk marathons, half marathons, do century rides, compete in triathlons. We have a hike program, and we train them and provide them a lot of amenities for the program, and in return, they raise funds for us. They raise the minimum
They kind
amount.
of coordinate their own thing, right?
We do it all for them. We have coaches, we have mentors, we coordinate all the travel, the hotel stays. If they're staying, we take people to San Diego, we take people to Alaska, Dublin, Ireland. So we coordinate all that. We coordinate the airfare, the hotel, all that kind of stuff. If it's local, they might have to get there by themselves. We also do the Light the Night Walk, which is in the fall. It's usually at the end of September every year, and actually the one in Albany is held at the end of September every year in the crossings right here in Colonie. We get about 1,000 people to come to that, and they each hopefully raise about $100 when they come. And we do Man Woman of the Year, which is a competition of community and business leaders who every dollar they raise counts as a vote. So at the end of the day, at our grand finale, which is normally in May, they are announced at the end of the actual grand finale because we're still counting money throughout the event, and they become the Man and Woman of the Year. But they do it in honor of a Boy and Girl of the Year who are local leukemia or lymphoma patients. We do a wine tasting here. It's called Taste of Compassion, which is a really fun event. We had about 400 people at the event this year. It's usually in the winter, kind of break up the doldrums. And we do a school and youth program, which is called Pennies for Patients, and we recruit volunteers in the school system to have the classrooms bring in spare change, and the classrooms compete with each other, and if they raise $300, they'll get a free pizza party or ice cream social, something along those lines. So we have a lot going on all the time, but it's imperative that we raise those dollars, because without them, we don't get the research. We're unable to provide the patient services that we have that Sabrina talked about. We're unable to bring new treatments to the table if we don't have the money for those things. So that kind of is the backbone.
Yeah.
It's one half of what our chapter does, but the other half is providing the patient services.
And I'm imagining that with only 11 people on staff in the coverage area that you cover,
It's a little
everybody's
challenging.
kind of busy, aren't they?
Yeah, well, everyone I talk to in the business community is really busy these days. It's been a challenging couple of years for everyone, and nonprofits have felt that as well. It's discretionary income that people are giving when they're giving to a charity. So, and there are so many fine charities in this area, which says a lot, I think, about this community, how the community supports these services for people in their community. So I think it says a lot about where we live and the people that live in this area.
See, I'm imagining when it comes to fundraising that if a person was actually competing with another person or with a group, that might be a little bit more impetus than, well, I'll just give $25 and I'll do the walk.
Yeah.
It's the competition.
It is. That adds a little something to it. I think, and with the team and training program, they all do it in honor of a local leukemia patient as well. Oh. So that really bolsters the motivation. You get a wristband and you put the name of your honor patient on it, and you're like, I have to get up at 6 o'clock in the morning to meet everybody at 7 over at Niskuna Bike Path, and I really don't want to do it. But, you have that wristband on, you're like, this person doesn't want to go to chemotherapy every day. This little girl didn't want to have bone marrow aspirations and all the things that they have to go through and the sickness. It's a small price to pay, and I think that really motivates people to get out there and do it. Same with the walk, with the night walk. It's a motivation because most of those people are touched by somebody that's been touched by cancer.
Now, how do you target organizations for fundraising? I'm imagining, I'm a town employee, and they offer to have money taken out of a paycheck every 2 weeks, and it's almost something that you don't even notice.
Yeah.
But I'm thinking even just a jar at a checkout, or buy one of these things and write your name on it and put it on a wall. So you're going through to the supermarket and you fill it out and you pay $1.
Absolutely, we do all those things. It's almost like everything you can imagine, we try to do it. And the things that we find that we do well, like the 5 campaigns that I talked about, are where we put most of our energies, because if you're doing something well and it's working, then continue and build on that and try to make it better and better. But we do things like that. We sell paper balloons for Light the Night, where you can buy them in a supermarket or retail outlet. We have coin boards that you were talking about that are also sent out to retail establishments across the country. We have direct mail that goes out through a contracted company. And then we do our own appeals through the office. So there's a lot of different ways that we're appealing to the community. And as far as companies and corporations in the area, we send them proposals for sponsorship. We're looking for them to be partners with us.
That's what you got.
And sponsor the events that we do. And we also look for media sponsors, so they can help with the tools that they have for public service announcements and things like that, interviews. So thank you so much for having us on today, actually, because this is wonderful for the Colonie community to hear about our organization. And certainly if someone knows someone or needs information, we're here for them.
Yep. Now, one more thing. Volunteers. Do you accept volunteers, and what kind of jobs would they be doing? Obviously, Sabrina is a volunteer,
We love
right?
them.
We love volunteers, absolutely. We're a volunteer-driven organization, a voluntary health agency, and we cannot survive without volunteers because we
Okay.
keep our staff to a limited number of people, yet there's tons and tons of work to do, and without the volunteers, we wouldn't be able to get it done. So for all the programs, team and training, we have coaches, we have mentors that volunteer to help us out. At the Light the Night Walk, we have probably 100 volunteers the night of, setting up, breaking down, running raffles, cooking food, all these different things that they do for us. We have people that come into the office pretty regularly, help us out with mailings, phone calls, trying to help us recruit people for, recruiting schools maybe for school and youth. We have an outstanding board that Sabrina heads up, 22 people on our board right now.
Wow.
And they just back us up all the way. So we really could not survive without the volunteers, and they're a precious commodity really for us, and we're always looking for more volunteers to help us out. So if anybody wants information on that, they should really contact our office as well.
Okay, so let's give the phone number for the Albany office.
Okay, it's 438-3583.
Okay. And we also want to give a web address.
Which
for
is
the
easy. It's
organization.
lls.org, Leukemia Lymphoma Society.org. If they're looking for local information, they can just put in their zip code, and it'll
Okay.
bring us to the chapter, what we're doing locally in the chapter, but it'll also give you all the information that the Society's website has.
Okay. And the other thing I wanted to mention at the end was the phone number for the Information Resource Center, 1-800-955-4572, in
Yes.
case they want to call and get information or literature.
That's actually run out of the home office, and it's staffed with professional social workers, people that have a lot of information. And the access is 9 to 6 from Monday through Friday.
Oh, okay. Well, thank you for coming in.
Thank you.
Thank you very much.
Thanks for everything
It's
you
a
did
pleasure.
for the community, too.
Thank you.
Thanks.
Thanks for watching. We hope to see you next time on Focus on Health.